Hello again. It's Wellness Week starting today until the 8th of July, and masks may be gone for now, but the long-term effects of COVID-19 linger on. Patients with serious mental illnesses also struggling to access treatment during the pandemic and to get their medication in the last few months. And this is a cause for concern. Let's discuss these and other issues related to mental health with the psychiatrist Dr. Suntheren Pillay. Dr. Pillay, good afternoon. Thank you very much for your time. I guess it is inevitable that the pandemic would have brought us to a space where issues of mental well-being, mental wellness are really top of mind now, literally, because people were locked down and we all saw our world around us changing, and now the stresses of life today, such as high cost of living, are impacting on all of us.
Good afternoon, and thanks for having me on air. What you're saying is absolutely true. We are now suffering from the COVID hangover. It's worse than having a night out and a hangover thereafter. The impact of COVID has been multifold. We have the direct impact of long COVID and its increase in anxiety and depression in patients, but we're coming out of a period of social isolation and lack of services. What people don't understand that while we were devoting all our energy to COVID and treating COVID, we tended to forget about all the other illnesses. And we also forgot about the most stigmatized group of people, which are the people with mental health problems, a uniquely stigmatized group. And often their mental illness, their schizophrenia, their bipolar, their chronic depression was neglected during this period of time. And it deteriorated acutely, often with some of them not having access to their medication, not being able to see their doctors, their psychiatrists or healthcare workers face to face. Often these people, their only social contact is with their mental health professions, and they don't do well being locked up at home. So yes, there's been an acute deterioration in all spheres of mental health post-COVID. And, COVID has also led to the fact that our food security has been tested, and the overall cost of living has seemed to have increased post-COVID, which is also causing a worsening of people's mental health.
What's the impact? I mean, I'm asking this, what are you seeing in your profession in terms of the impact of this hangover from COVID, this lack of neglect of attending to mental health issues, the deterioration of mental health cases?
Look, the problem is that our patients are coming in far sicker than before. By the time they've now presented for care, they should have come for care a year ago. They're coming in more ill. The hospitals are more full. There's been an increase in suicide rates among patients as well. And so what we're having is sicker patients coming in for help. And people have actually committed suicide for non-COVID related illnesses since they didn't have adequate access to care.
So the rate of suicides has increased in the country, and people have delayed to receive medical care. Going forward, I mean, this is going to have a long-lasting impact, I guess, on people's lives.
Look, there'll be multiple areas of long-lasting impact. First, of course, we cannot neglect long COVID, so direct effect of COVID on the brain will have a long-lasting impact. But there will be a long-lasting impact on people from many aspects around COVID, apart from our fact that our chronically mentally ill people are more ill. Almost every one of us has lost a loved one, and all of us are dealing with grief, and we haven't been able to grieve properly. We haven't been able to get the closure from people dying. We weren't able to get the social support we needed during COVID. So grief processes are a lot harder. There's a lot more complex grief going around, and there's a lot more depression during complex grief going around. Families have lost their loved ones. They don't have the support. And also another important aspect that's neglected is the effects of masks. There's huge debate on how effective masks really were. Did they really prevent COVID? But, human beings need to interact with each other. They need to see each other's faces. They need to smile. I mean, we are communal creatures. One of the highlights of our days is seeing a smile on somebody else's face. Children need to interact with each other. Children need to learn what other people's facial expressions look like. So we're depriving people of essential social contact, and human beings are social beings. So all of this is going to have a negative impact ongoing on our mental health.
Would you say, just on the mask, before I ask the next question, that our children would suffer from mask anxiety or stuff like that?
They definitely do, sir. You know, we now have patients that will come to my rooms and refuse to take their masks off. And even if I tell them, come on, take your mask, it's easy for me to interact with you, they're now scared of living a life without masks. Masks were drilled into people's minds, often with good reasons, but now children have fears of going without masks. Masks have become the next lioness blanket. It's like a layer of protection over your face that protects you. So yes, the masks are going to have a long-lasting impact on people because we now need to desensitize a person to a life without a mask.
So this post-COVID trauma, shall we call it, that we're all suffering from, different reasons. Either we haven't grieved sufficient, we didn't grieve for our loved ones, we haven't found closure, or we've lost jobs during the pandemic. We know that in 2020 alone, this country shed 2 million jobs, and the majority of them were women. 2 out of 3 jobs lost in 2020 were women. And South Africa is a majority of women-headed households in this country. So it's going to impact on how we perform as well as citizens, I mean, going forward, as people going forward, as we grapple with today's new challenges, like the cost of living that you've mentioned. So this trauma is going to be with us for quite a long time.
Definitely. I'm glad you're bringing up, because as we address the COVID pandemic, we forgot about what the real pandemic is for South Africa and Africa. Africa has an unemployment and a poverty pandemic, and more people die to the negative effects of unemployment and poverty than due to COVID at any point in time. Now, COVID has worsened our unemployment crisis and worsened our poverty crisis. And naturally, when you worsen unemployment and you worsen poverty, it has a negative impact on a person's mental health. I mean, human beings need dignity, they need jobs, and they need food. And the problem with COVID coming along is that we neglected key issues like jobs, food, and human dignity. And we overzoned in on a virus and forgot what the negative impact of all this economic lockdowns and what the negative impact is going to be, that we now have a poorer society. And, poverty is a bigger killer and a bigger negative impact on people's mental health than COVID would ever be. And the loss of jobs is the real crisis South Africa faces at the moment. I mean, this is another problem. I'm currently in private practice. My patients can't afford to see me. During COVID, we've had to see a lot of patients on a pro bono basis, but they now have lack of access to healthcare. And then these patients are going to then go on to the state system, which is our mental health system, which is already overburdened. So yes, poverty, lack of food, lack of jobs is going to be a far bigger problem than COVID. COVID might still be around in a milder, attenuated form and probably won't go away. But the poverty epidemic needs to be seriously addressed at the moment, because this is a real pandemic that's facing Africa. And I wish this gets addressed as seriously as the COVID pandemic was.
And in that focused manner, with the same energy and focus. Final question to you, Dr. Pillay. You said you are seeing more people coming to see you in terms of consultations for mental health. We know in our society there's a lot of stigma around mental health issues, whatever the mental health case is. What would your advice be to somebody now watching and listening to say, we've got this COVID-19 trauma, post-COVID-19 trauma, we are dealing with these high levels of poverty and unemployment and the high cost of living, and I'm seeing these signs. What must they look out for and what must they do?
Well, the first thing you must do is seek help. The most important thing for you to do is seek help. You must not be afraid to go for help. Go for help to your healthcare practitioners, go to help to your friends, go to help to your religious organization. We are social beings. Reach out for help.
Thank you very much, Dr. Suntheren Pillay. Sorry, we're going to have to end it there. Sorry, you were saying and? Sorry, Dr. Pillay?
And if you can't get to help, in addition to that, we must reach out for general things that we've neglected before. Reach out for exercise, reach out for meditation, reach out for mindfulness, reach out for a healthier style of living, which is very important. Just don't reach out for a mask anymore.
Thank you very much, Dr. Suntheren Pillay there. He's a psychiatrist. Of course, this being a Wellness Week, we're just focusing there on the post-COVID-19 trauma. We've all been traumatized in one shape or form by the pandemic, and here have been seeing lots of new cases of people with mental health. Do not be afraid. Just reach out. Don't leave it until it's too late.